Hello, my name is Dr. Sylvester Odanga, and I'm a researcher and practitioner in educational psychology, counseling, and adolescent mental health. I am based at TINADA Youth Action Africa and train students in high schools and junior secondary schools and even universities on counseling, mental health, and life skills. Over the years, my work has focused on supporting young people through counseling training and school-based intervention. My core interest is simple but urgent. How do we move from isolated mental health support to scalable systems that can reach every adolescent who needs help? This project is built on that question. And so what is the problem that I'm trying to fix? Adolescent mental health in secondary schools in Kenya is an increasing concern across, just as it is in many low and middle income countries. And in many schools, there is a lot of anxiety, depression, substance use, social pressure, stress associated with academics and exams. On the other hand, most schools rely on a small number of trained counselors, and in some schools, they don't even have trained teacher counselors who are handling the students. There are three core system level gaps. First, there's severe shortage of specialized child and adolescent mental health professionals. Secondly, school-based support systems are fragmented and not integrated into daily school operations. Third, existing approaches are not designed for scale. They often depend on external specialists or pilot programs that can be sustained. This is the gap my research is trying to address. And so, this study evaluates a scalable, task-shifted school mental health system for adolescents in secondary schools in Kisumu County, Kenya. The study will use a cluster randomized systems transformation design where schools are the units of randomization. Schools will be assigned either to an intervention condition or to usual school mental health practices. The intervention is a task-shifted mental health system embedded within the school system. In practical terms, this involves training selected school staff, including teachers and existing student support personnel. The system also includes simple screening tools, structured referral pathways, and clear protocols to follow up within the school system. At the student level, we will assess changes in mental health systems, help-seeking behavior, and school functioning. In simple terms, the study asks one key question: can we design the school system itself to deliver basic, effective, and scalable mental health support for adolescents? And so what is the innovation and implementation science of this study? The innovation in this project lies in the systems level approach. Rather than testing a standalone mental health intervention, these studies tests are redesigned and service delivery system within schools. It applies task shifting, not just as a workforce strategy, but as a systems transformation tool. The intervention is grounded in implementation science principles, including feasibility, acceptability, scalability, and sustainability. This is important because many mental health interventions fail, not because they are ineffective, but because they are not implementable at scale. Our aim is to bridge that gap between evidence and implementation. This project is deeply rooted in the realities of low and middle-income countries, especially Kenya. In any LMIC education systems, mental health services are limited by workforce shortages. They are limited by workforce shortages and by many other access to services within the school. A central focus of this work is equity. The intervention is designed to reach students who would otherwise not be identified or supported within existing systems. And so by embedding mental health support systems within schools, the project aims to reduce disparities in access and ensures that adolescents in under-resourced settings are not left behind. A key component of this project is capacity building. The intervention will train school-based personnel, who are mainly the teachers in the guidance and counseling department, and the students, who are called peer counselors or peer educators in Kenya, to identify and respond to adolescent mental health needs. This builds internal capacity within schools rather than relying on external specialists. In addition, the project will strengthen research capacity by involving local research assistants, students, and early career professionals in data collection, analysis, and implementation process. Sustainability is central to the design. The goal is for the intervention to be embedded within existing school structures, such as the guidance and counseling department that I've spoken about, and the peer counselor system, and potentially integrated into education policy and school health programs. Ultimately, the aim is not only to improve outcomes during the study period, but to leave behind a functioning system that schools can continue using after the research ends. My closing statement is this. In summary, this project evaluates whether a task-shifted school-based mental health system can be implemented at scale to improve adolescent mental health outcomes in Kenyan secondary schools. It combines a rigorous cluster randomized evaluation with a systems transformation approach grounded in implementation science and equity. My long-term goal is to contribute to the development of scalable, low-cost, and sustainable mental health systems for adolescents in low-resource settings. This fellowship will enable me to advance this work, strengthen implementation research capacity in my context, and contribute to global knowledge on how to make adolescent mental health care more accessible and equitable. Thank you very much for considering my application.